Hello friends, today we are learning about adrenergic system. We'll be covering this under two sessions. In the first part, we'll be covering the anatomy of the sympathetic nervous system, the receptors and the actions of the sympathetic nervous system. And the second part, we'll be dealing with the sympathomimetic agents. Okay, so autonomic nervous system, what is it? It's an involuntary system that is divided into sympathetic, parasympathetic and enteric nervous system. Sympathetic system is mainly responsible for your fight, flight or fear responses. That is how the body reacts in a stressful situation or an emergency situation. Whereas parasympathetic is mainly involved in tissue building responses. That is, you can survive even without your sympathetic system provided you maintain a stress-free environment, whereas you cannot survive without your parasympathetic system. Okay. So now, next coming to the anatomy and the neurotransmitters involved. We'll study with the help of this diagram. So you can see here the sympathetic fibers originate from the thoracolumbar area, that is from T1 to L2, L3 levels. Okay, and they have a preganglionic fiber and a postganglionic fiber. You can see here for the sympathetic fibers, the preganglionic and postganglionic are almost equal. Whereas in case of parasympathetic fibers, the postganglionic fibers are very short. They are located very close to the effector organs. Okay, so that is one difference between sympathetic and parasympathetic. Now coming to the neurotransmitters, the neurotransmitter at the preganglionic fibers is acetylcholine. Whether it is sympathetic or parasympathetic, it is acetylcholine. Okay, whereas in the postganglionic neurons, in case of sympathetic fibers, they are releasing norepinephrine in most of the places, except few areas. One such area is sweat glands, okay, where the pre and postganglionic fibers releases acetylcholine. Okay, another area is adrenal medulla, okay, where the methylation of norepinephrine is taking place and adrenaline is released as a neurotransmitter. Then in the kidneys, where dopamine is getting released. So these are the few exemptions. All other places, it is norepinephrine that is getting released. So now we'll see how these neurotransmitters are getting synthesized. So it is synthesized from tyrosine. Tyrosine is getting converted into dopa with the help of tyrosine hydroxylase. Okay, and this is the rate limiting step in the synthesis of norepinephrine. And this site is being inhibited by the drug metyrosine. Okay, we use this during pheochromocytoma, that is surgical removal of pheochromocytoma. This drug is used to control the hypertension. Okay, then this dopa is converted into dopamine with the help of dopa decarboxylase enzyme, and dopa decarboxylase enzyme is being inhibited by drugs like carbidopa, bensericide, which we will take in detail when we cover the Parkinsonism chapter. Okay, and then once this dopamine is formed, dopamine is carried inside the synaptic. This is a synaptic vesicle. It is carried inside the synaptic vesicle with the help of a transporter that is known as VMAT, vesicular monoamine transporter. Okay, and the dopamine reaches inside the synaptic vesicle, and this VMAT is getting inhibited by drug known as reserpine. Okay, and the other drugs that inhibit this VMAT is tetrabenazine, deutetrabenazine and valbenazine. Okay, reserpine was used for hypertension and some other disorders like hemibalismus, tardive dyskinesia and all, but these days its use being reduced. Okay, and the main side effect of reserpine is depression. Okay, and then once it reaches a synaptic vesicle, it is converted with the help of dopamine beta hydroxylase into norepinephrine. Okay, and dopamine beta hydroxylase is getting inhibited by the drug that is known as disulfiram. Okay. And so the norepinephrine is getting stored inside the synaptic vesicle, and whenever the action potential comes and there is entry of calcium into this nerve terminal, this causes the synaptic exocytosis of this vesicle and the release of norepinephrine. Okay, and this release of norepinephrine is inhibited, okay, by drugs like bertilium, guanethidine, and these are being mainly used in hypertension. Okay, and norepinephrine, once released, they go and act on the receptors, that is alpha and beta receptors, and once their action is over, it has three fates. Either it gets metabolized, okay, by enzymes like monoamine oxidase and catechol O methyl transferase, or they get taken back by the neuronal reuptake mechanism. Okay, or what they do is they go and activate the preganglionic receptors, that is, in case of adrenergic, it is the alpha 2 receptors, and by activating alpha 2, it causes a feedback inhibition of release of norepinephrine. Okay, that is, it acts like a brake. When alpha 2 is stimulated, it decreases the release of norepinephrine. Okay, and there are drugs acting at this level. You have alpha 2 agonists like clonidine, then drugs that inhibit the reuptake like cocaine, tricyclic antidepressants, SNRIs. Okay, and then you have drugs that inhibit this metabolizing enzymes like MAO inhibitors and COMT inhibitors. So the details of these drugs and where they are being used is given in the notes. The next most important area is your receptors, adrenergic receptors. So it is very important that you should have a clear understanding about where these receptors are located and what are its actions. Okay, so you divide adrenergic receptors into alpha receptors and beta receptors. Both are G protein coupled receptors. Okay,